So there's nothing inferior about being an integrative mental health practitioner who focuses on identifying symptom clusters and patterns and then proceeding with a nutraceutical treatment plan thereafter. While identifying root causes is more at the root of functional medicine and integrative psychiatry, they both lead to treatment and to happy patients. Often, your initial nutraceutical interventions can get you on first base and can produce some benefits during the first month or two of treatment while you're pursuing the more time-consuming, expensive diagnostic tests in the functional medicine realm, while you're doing gut work, dietary and other interventions that take more time to take root. Since matters of safety, informed consent, efficacy are really fundamental to integrative practice, to feeling comfortable treating patients with nutraceuticals, individuals who are ill. They might have suicidal ideation. How comfortable are you treating someone, with SAMI, who is depressed with suicidal ideation, for instance, someone who has an active bipolar state? Some general considerations regarding safety is quality control. Even some of the high-end products that are manufactured in the U.S. are using base products that are manufactured in China and India, as are most pharmaceuticals nowadays as well. Different formulations, even for the same biotherapy, particularly if we're talking about botanicals. There could be interactions. Even though they are nutraceuticals, these are real therapies. And then there's ethical considerations, including selling product in your office. And then you don't want to promote too much the mentality that the only way to help someone is a pill, And then for the patient, there will often be greater out-of-pocket costs, the pill burden, multiple dosages per day. And then, they buy different products they think are the same. So it's really important to be a bit compulsive about monitoring the products the patient is taking at your follow-up appointments. Don't fall into a complacent state. The patient will come in and they're in a different state of symptom relapse or new side effects. They say they're taking the same product. It was on sale at the end cap at the supermarket, and you find out it's actually something different. Magnesium, an essential nutrient, a giant in terms of micronutrients, often overlooked. It doesn't, hold the same potency perhaps that SAMI and many other biotherapies do. There can be interactions, very well tolerated in terms of serious safety concerns, although GI side effects are common. If someone has chronic kidney disease, you need to be mindful of that since you can get greater retention. So B vitamins, big. They can be used as monotherapies, but most of the evidence base is as adjuncts. We have B6, 9, and 12 that really stand out for the CNS. But really, it's there's value in all of the B vitamins. The use of methylfolate is to some degree, in my mind, determined by a person's MTHFR status. It's a test that you can get done with Quest and LabCorp. Most insurance plans will cover it. Medicare does not, so you don't want to get your patient stuck with a $400 list price bill. Vitamin C, I don't really think of it, but there's actually substantial evidence base, mostly from last century.